So we talked about the protocol prior to coming, and then when we arrive in Mexico, we have a consult, and then we have 2 loading doses. And then after that, we go home with a protocol. Can you talk through that a little bit for everyone to understand?
Sure. So to go back even a little bit further, we talked about, where you work with your doctor at home to make sure that you get the necessary prescriptions to do that sort of clean out phase before you come here. And then once you're here, one of the things that the kids do in the first days is that they do what we call a bowel cleanse. So we want to make sure that any of the antibiotics, whether it's vancomycin or nystatin or whatever it is the doctors prescribe, that's cleaned out of the system so that the new bacteria that we're putting in are not going to get killed off as a result of it. Plus, we want to have more real estate, more area for this healthy bacteria to go in and take root. So we do that clean out. Usually that's just with magnesium, and our goal is to just get it as clean as possible before we begin treatment. And then while here, there's 2 days of what we call loading dose. I didn't mention it before, but a lot of the study, the idea is, what we're doing is mimicking the work from Arizona State University, and that's in essence what they did. 2 days of very high dose of bacteria, followed by daily maintenance. In their study, they did 8 weeks. In some of their new studies, they're doing 12 weeks. We're doing 16. So the idea is to sort of, really hit the gut with a large dose of bacteria. And the way that I think about it is it's kind of like, bringing in the military. You're just like going in with full force and trying to just inundate that system with a whole bunch of healthy bacteria that can come in and take effect and take hold. So that's in essence what happens here. And I think that's best done under medical supervision, just to make sure that all goes well. And then, as you alluded to, you go home and you complete the rest of the treatment, which is a daily dose of the bacteria. And the way that I like to think about that is, if you just did one big large dose, it might result in some benefit, some change, but the microbiome, in effect, has like a memory, and so you want to remind it every day for a period of time what this healthy microbiome is, so that it becomes like a fingerprint, like it becomes its own now. So it does take a reminder. And prior to this work that was done in Arizona, it was not clear that FMT was really effective for autism, and a lot of that was because people were just not treating it for long enough. They weren't doing a treatment for long enough, and so with this change, a longer treatment definitely is necessary, and that's what that daily dose is needed for.
So with that, talk about the results. So I'm sure it varies for each kid. How soon do you see results? Do you typically see results within a few days, within a few weeks? Does it sometimes take months before?
Yeah, good question. I get this one a lot. So you're right, it absolutely varies. What I usually tell people is that by around 5 weeks is when you can begin to notice changes in the digestive symptoms. So as anybody listening, especially if you have a child with autism, most kids with autism have pretty severe digestive issues, whether it's constipation, diarrhea, or abdominal pain, which you may or may not know, or undigested food, or the list goes on. So those symptoms tend to improve first, and then about 3 weeks later, so at about 8 weeks, is when we begin to notice more of the autism-related symptoms beginning to change. That might be anxiety or hyperactivity or sleep issues. And the way that I sort of think about it is, first we fix the gut. Once that gut barrier and gut integrity is working, we're producing the short-chain fatty acids, which reduce inflammation, and so on and so forth. It begins to allow healing in the brain. And that's where we can see more improvements with speech and anxiety and so on and so forth. Now, with that said, there's cases where, within the first couple of days, when families are here in Mexico, they're telling me, wow, my child has way more eye contact, or they're sleeping better, or, they're much calmer than they used to be. So there's always, differences between children, but in the scheme of things, you're gonna know within the first 2 months for sure that something's happening, you're making progress. And again, talking about the study that was done in Arizona, they followed up 2 years later. Right, so this is something that I think people have to understand is a slow and steady process where you slowly make progress and you slowly make gains. Definitely we see ups and downs. It's not necessarily like a straight shot up. There can be some setbacks where you say, wow, or suddenly we're getting some constipation again, and so it is very normal to see ups and downs.
Are there better results when you follow a certain diet?
Yeah, diet is a great question. I'm very against restrictive diets. I know many people have to be on them to be able to, have some, have proper bowel movements or proper behaviors and things of that nature. But our goal with FMT is to expand the diet as much as possible once we begin starting with FMT. So many kids come to us, they're gluten-free, dairy-free, soy-free, corn-free, those types of things. I'm not really talking about those. I think it's fine to continue those, especially if you notice benefit with it. But in the long term, we want to expand and include as many new foods as we can in. Now the reason for that is because we transplanted this, bacteria in the system now that are a lot of different kinds, and the way to sustain them is to have a lot of variety in what it is you're eating, because different bacteria digest and ferment different foods or different fibers. And so if you're only eating 5 foods, you're going to be starving off some of the bacteria that you transplanted. So we want to keep getting as much diversity as we can in the diet to sustain the diversity of the transplanted bacteria. So whatever kind of diet that allows you to introduce as many new foods, fruits, veggies, meats, nuts, seeds, whatever. I'm not talking about, McDonald's and junk food,
Right.
but just as much healthy, different food as you can. And some kids, they may have had an issue before with dairy, and the parents say, oh, they managed to grab some cheese off of the counter and they ate it and they had no symptoms. So we definitely see that food sensitivities and food reactions do decrease. And some kids, have sensitivities to textures or tastes or colors or whatever the dynamic might be. And we also find that subsides a lot. So some kids come to us, they're eating 2-3 foods, in some cases 10, 12, it really depends. But in all of the cases, they're able to increase and expand with time.
Can we talk about the maintenance doses? Because there's been a lot of questions about capsules. How do you get a kid to take capsules? Theo doesn't do capsules at all.
Right. So that's a great question. We have some kids that are as young as 3 that are doing treatment and they can swallow capsules, and then kids that are as old as 12, in some cases 15, and they still aren't able to do the capsule route. So when a child is able to do capsules, we can do the whole treatment with capsules. If not, then we have to start the treatment out. That loading dose for the first 2 days is an enema, and as you would imagine, an enema, it goes up rectally. Bottom up, as we say. And then maintenance beyond that is it's a little vial that has the bacteria in it. It's basically colorless, it's basically tasteless, and you mix it with water or juice or kombucha or whatever, coconut milk, and we've never had a child to date that had any issues in drinking it. Even kids that have extreme sensitivities to colors and tastes, which we've worked with a lot of them by now. And so very palatable and works very well. Now, the main difference between the capsule group and the sort of liquid group, as we call them, is that the liquid group needs to take what's called a proton pump inhibitor to lower stomach acid, because we're putting in this, this liquid, and it has the bacteria, and acid in the stomach would kill off the bacteria. So we want to reduce that as much as we can before giving the dose each day, to then allow more of those bacteria to survive the acid in the stomach and work their way through the intestines.
So is there any of those methods that's preferred over the other?
Yeah, this is a good question. I mean, for me, it's easier when someone can do capsules, so I prefer that. It makes it so that you don't need to use a proton pump inhibitor, which is also something I would prefer. But otherwise, from an effectiveness standpoint, the very first study that I've been referencing, they only used either enema or oral route using liquid. So they didn't use any capsules in their first study. In their newer studies, they are using capsules, not from the standpoint because they're trying to get a different outcome. They're doing it because they're trying to patent their new approach, and so they're doing it that way. But no, we do both. It's probably between 50 to 80% that are doing the liquid, and then the other 20 to 30, 40%, just depends. Every group changes. We'll do the capsules, but in both groups we see great outcomes. I can't tell yet that one is much better than the other, but in my mind, if you need to wait until your child is able to swallow capsules, you could be waiting a while. And I think there's an advantage, when possible, to treat sooner than later.
Yeah, we're doing the liquid.
Right.
So another question that we got over and over again is, are there any age stipulations? Is it better for young children? Will older children still see a difference, or even adults?
Yes. So we work with kids as young as 3, and we have no age limit. I mean, I've been doing FMT for over 2.5 years now, and I've had patients into their 70s that are getting treatment. Now, those aren't patients that have autism, but for other conditions, inflammatory bowel disease, post-cancer, post-Lyme, and many other
Celiac?
indications. I wouldn't choose FMT to treat celiac, although there might be something to it. And it depends, on the cause of celiac. Some people develop celiac after they go on an antibiotic. And so that may have something to do with an imbalance in the gut microbiota. So it would really depend on the case. But most people, if just avoiding gluten solves the problem, it's probably easier than, going through the effort of doing an FMT, although maybe not. But I haven't done it just for that specific reason. So back to that, to your question, yeah, as young as 3, I do feel, if possible, that doing it sooner is better, because the way that I think about it is if we take a child, let's say that's 5, and we take a child that's 15, and we follow them for 10 years, well, the child that's 5 is more than likely going to see a much larger gain, right? Because they're still learning, they're still developing in many different ways compared to the child who's 15. Now, with that said, we treat 15-year-olds that can see results that in many cases can be life-changing. I mean, if you can take a child that's got severe anxiety and that improves, or severe constipation, they need to have an enema every single day just to have a bowel movement, and that no longer is the case, I mean, it can really change both the child and the family's life. So we work with adults with autism up into their 20s. I think maybe the oldest is 29. And yes, they do see benefit, but comparatively, I wouldn't say it's to the same amount that younger kids can experience. So still possible. I think there's still definitely hope for adults with autism. I would definitely encourage it. I think perhaps as I'm doing more of this, I'm feeling that maybe a higher dose for even a longer period may be necessary for an adult. And we're starting to test some of that with the adults that we work with. But otherwise, if your child is 12, it's not too late. It's just, it would be nicer if they weren't, and they were younger and we could catch this earlier. And not only that, you could see more gains, but more importantly, that we could get them out of pain if they're in pain, or we could improve their quality of life and allow them to be, maybe more social, or have a friend, or show affection to their siblings or their parents, and, learn in school, have focus. So there's a lot of, those things that I think if we can do them early, allows us that ability to, have them move much further, faster.